Ministry of Health says there is good news in the control of cholera as the rains set in. Public Relations Officer of the Ministry, Tony Goodman, says the Ministry has scaled up its awareness creation and provision of necessary supplies to ensure that there is no outbreak as the rainy season starts. Following a reported case in Achimota in April, the Health Ministry issued an alert calling on citizens to be cautious of cholera ahead of the rainy season. And but now it looks like there is some good news in that regard, because apart from what happened in April or that reported case, we've not had any other report of a cholera case. And I would want to speak to the Public Relations Officer of the Ghana Health Service, Mr. Tony Goodman. Good afternoon, sir. Thank you very much for your time.
My pleasure.
Yes, to start with, are we to start jubilating and celebrating that at least 1 month down the line, we have not recorded any other case of cholera apart from what we heard of in Achimota?
Good afternoon to our listeners and viewers. What we are supposed to be doing now is to intensify our campaign and also drum home the message of personal hygiene and also making sure that we keep our surroundings clean. That is what we are supposed to be doing together with you, the media, now. We are not out of the rains yet, so the best thing for us is to keep drumming home the message for people to change their behavior and lifestyle. That is the critical thing all of us should be looking at, not to jubilate at this point.
Right. And can you tell us what specifically the ministry did around this time to ensure that at least there seemed to be zero recorded cases?
What we did together with you, the media, is to continue sending reminders around, making sure that at least from the beginning of this year, we started the campaign early. We've also did what we call recall. We let everybody in this country know exactly what happened in 2014 and 2016, how devastating it was for us as a ministry and as a country to have this number of people die as a result of cholera, which is not right as a middle-income country. And then we are continuing this with various community debates, various visits to various homes. Local government is supporting with their monthly sanitation exercise, and other agencies who are also doing this together with us. So the multi-sectorial approach towards the fight is what has really helped, and that is the way we have to go in any other aspects of healthcare delivery. We just have to collaborate with you, the media, and other agencies who have some stake in making sure that Ghanaians are safe.
And can you briefly help us with what the strategy is and whether this is not a 9-day wonder?
Yes, we have a strategy, and I don't think it's a 9-day wonder. We are talking about behavioral issues. So what we want you to do is to tell them what we are doing. One, we have informed all our district and regional health directorates. We are using our volunteers in the various communities to go to various homes to tell them what we're looking for. We're also tracing every case that presents in the form of diarrhea. We do various, for instance, the case that happened, the only case we recorded in the Achimota Hospital. We went further into the various communities to do what we call investigation and audits. Followed up individuals who had something to do with that particular patient. So we are not leaving anything to chance. Everybody in the country, from our development partners to the ministry to all of our agencies, we are all doing our best. We are not leaving anything to chance, making sure that everybody in the community is aware. Various schools, our SHEP program, the community, the health education officers are also in this, going from one house to the other. So these are some of the measures we put in place. Our surveillance units have also been triggered. Our various units in terms of disease control officers are all looking out to see how best we can reduce cholera. These are some of the things we are doing.
All right. I would want to say thank you very much. But before you go, we have just had news about something happening in at Kolebu Teaching Hospital. If you just indulge me to ask you briefly, that some 15 nurses posted there seem to be stranded. Has this come to your attention?
I don't know how somebody posted to an institution will be stranded. Before the posting, the person said, I'm stranded. Now you've been posting, you say you're stranded. Nobody is stranded. If you need to work in an institution, if you are posted to an institution, go straight to the PR unit there or the HR there, talk to them, and they'll give you the right information. I have also heard that they are abandoning some information here and there, which is themselves. So as a result, they get confused by the numerous information that is being channeled there. So they should just go to the right source for the right information and stop their what chart which they think is the right source of information. They should go to the PR unit and the HR information. They should ignore any other information they get from their colleagues in the media.
Okay. We are grateful for your time, Mr. Goodman. Thank you very much for the good news also about the cholera control as well as the malaria control, and then also the issue of the nurses at the Korle Bu Teaching Hospital. Tony Goodman is the Public Relations Officer of the Ministry of Health.